Disorders of dorsal inductions result in defects of closure, anencephaly, encephalocele, gyri malformations, and spinal dysraphism. First is anencephaly, absence of the cranial vault. Cranial vaults is the coverings of the skulls absent cerebral hemispheres and diencephalic structures 1:1000 births. Acrania. Acrania, it means no skull plus normal brain tissues. Exencephaly, no skull plus amorphous brain. Anencephaly, no skull plus no brain. Amorphous brain, it means amniotic fluid. Deposition of the excessive amniotic fluid. Acrina anencephaly sequence. Anencephaly in which antenatal US detectable at 11 weeks, 100% accuracy at 14 weeks, no brain tissue above orbits, absent calvarium, may found parts of occipital bone and midbrain. Exencephaly have small amount of neural tissue, low CRL, frog eye or Mickey Mouse appearance. Polyhydramnios. Polyhydramnios, it means anencephaly. This is the pictures of the anencephaly. Cephalocele, defect in skull and dura with extracranial extension of intracranial structures. Most common in midline, causes several failure of neurulation, herniation after neurulation, failure induction of bone, failure of basilar ossification center to unite. Cephalocele, pathological classifications based on the contents of the sac. Meningocele, meningocephalocele, meningocephalocystocele, arthritic cephalocele, gliocele. In which CSF is divergent the other parts of the brain. Cephaloceles. This is the anatomical classification based on the location of the defect. Occipital, and this is the pictures of the location of the defect. First is occipital, parietal, frontoethmoidal, transsphenoidal, nasal, and also this is the pictures of the location of the defect of cephalocele. Cephalocele frontoethmoidal, in which there are three subtypes: frontonasal, nosoethmoidal, nasoorbital. First is frontonasal. Frontonasal, it means between the frontal and nasal bones. Frontal bone displays superiorly. Nasoethmoidal, between nasal bone and nasal cartilage. Nasal ethmoidal, nasal septum and ethmoid bone displays postero-inferiorly. Nasoorbital, in bony canal at medial wall of orbit between maxilla and lacrimal ethmoid bone. Frontal process of maxilla displays anteromedially. Lacrimal and lamina paprachia displays posterolaterally.